Hello, everyone. Thank you for joining today's MIPS data submission for Year 2, 2018 of the Quality Payment Program Office Hour session. The purpose of this webinar is to answer frequently asked questions about submitting MIPS data for the Year 2, 2018 of the Quality Payment Program, as well as the data submission feature on the qpp.cms.gov. The presentation will be followed by a question and answer session where attendees will have the opportunity to ask questions. Now, I will turn it over to Adam Richards, Health Insurance Specialist in the Center for Clinical Standards and Quality at CMS.
All right. Thank you, and greetings all. Thank you for joining us today for this special office hour session on MIPS data submission for the 2018 performance year. Our goal today is to ultimately provide you all with a platform to ask questions, provide feedback, flag any concerns that you may have, so on and so forth, as it all relates to the current data submission window. We have a number of our experts here in the room and also on the line to provide support, and we will do our absolute best to answer as many questions as possible as our time allows today. Please do be aware that there may be instances where we need to take your question or concern offline and follow up with you individually, especially if it is related to a very specific issue and we need to do a little background research. So just please keep that in mind, and we'll go through that a little bit later when we get into the Q&A portion of our session. Now, before we get to that point, we always think it is beneficial to run through a couple of high-level announcements and topics that may address your questions and concerns right away. So please bear with us over the next, 10 to 15 minutes, and then we'll get started with the open Q&A portion of our call. I do want to note that a copy of this recording, the slide deck, and the transcript will be available within our webinar library on qpp.cms.gov in about 2-ish weeks. Highly encourage you to sign up for the QPP listserv if you haven't done so already, just to be alerted when these resources post, as well as for all other types of communications related to the Quality Payment Program. Okay, with that, we're going to charge along. I'm on slide 3, just to cover some of our topics today. Again, we won't spend too much time, at least not from our end, doing a lot of the talking. We want to hear from all of you. But basically what we'll do here is just kind of walk through just an overview of submitting data for 2018. We'll talk about some key dates that we just want to make sure that you're all tracking to, talk a little bit about submitting data through the QPP website, as well as just talk a little bit about the new HARP system, the identity management system that we have available. Also talk a little bit about our resources, our technical assistance that is available and on the ground right now, that is out there ready to help you submit your data and make sure that you are successful for 2018. And then we'll get into our open Q&A session. We do have some frequently asked questions that have come through from different channels over the last couple of weeks, so we'll take a look and we'll go through some of those questions before we get into the open Q&A, and hopefully this will help to answer some of the questions that you may have, but after that we'll turn it over to you. Okay, charging forward on to slide 5. So as I mentioned, we do want to just make sure you're all tracking toward the key dates that we have here. Of course, we are in the submission period, which opened on January 2nd. That does run through April 2nd, 2019 at 8 p.m. Eastern Time. This is the period of time where clinicians do submit their MIPS data to us from the 2018 performance year, either through the Quality Payment Program website or through potentially QCDRs, qualified registries, etc. I do also want to call out, if there is anyone on the line who is working with or submitting through the CMS web interface, the time frame is a little bit different. That opened January 22nd, and that runs through March 22nd, 2019. So a few more weeks remaining for the submission period. Still plenty of time to get data into us if you haven't done so already. I'll also mention we do have weekly CMS web interface webinars that are being hosted throughout the data submission period. If you haven't been able to attend and you are using that mechanism, please check those out. I think they're very good at helping with triaging and navigating some of the CMS web interface reporting aspects. Also want to mention, if you are participating in MIPS as an individual clinician and you choose to use claims to submit quality performance data, those claims, those quality data codes, the QDCs, you'll attach those QDCs to your claims throughout the 2018 performance year. You should have attached those claims throughout the performance year. The last day for the 2018 claims with quality data codes for the 2018 performance period is determined by the Medicare Administrative Contractor, but they must be processed 60 days after the close of the performance period. So we highly encourage you to continue working with your MAC. If you have been working with them, if you haven't reached out, please do so as well. Charging on to the next slide, slide 6. Again, just talking a little bit about data submission at a high level. We always talk about, when we refer to submitting data to us, we talk about submitting through the Quality Payment Program website on qpp.cms.gov. If you navigate to the website, you'll see the login feature in the top right-hand corner. You'll just click on that and you'll use your identity management to sign in, and we'll talk about that in just a minute or two. But when you log into the system, you have the opportunity to submit your 2018 data through file upload or to attest to certain performance categories, specifically promoting interoperability and the improvement activities performance categories. So there's a lot of great features behind the submission login. So once you log into that authenticated site, there's a lot of really great features and helpful tips as a part of submitting your data to us. We'll also say, and as you can see on screen, a little quick tip, you can submit and update your data throughout the submission period. We automatically save your data and we update your records in real time. So this allows you to continue to come back in and checking back in with us without losing any of that data. We've always said submit as early and as often as possible. We want you to keep checking everything that's inside there just to make sure everything's accurate. And if you are having any challenges, these are what these forums are for, but we also have technical assistance as well as our service center that can help walk through any issues that you may be experiencing. Okay, moving on to slide 7. Talk a little bit about the new HARP system. Some of you may have heard about this as you're preparing and as you're working into the submission period. Others, this may be some new information, which is also okay. But we do just want to talk through a couple pieces of this. So during and following submission for the 2017 performance year, we heard from many clinicians, practices, support staff, some of our third-party vendors that the enterprise identity management system, had its challenges. In many cases, it took too long to create an account. You had to establish separate roles for each program that you're a part of. Many times you had to remember multiple IDs and passwords, which can become a bit tedious over time. So we looked at the entire system, and we decided that it really was time to move away from eIDM and toward a more intuitive and user-friendly system, which we are calling HARP, as you can see on screen. So on December 19th, we made that transition from Enterprise Identity Management to HARP, which is the HICS Authorization Roles and Profile System, to really help streamline the process for eligible clinicians to obtain an identity management account, view, submit, and manage their data behind the authenticated experience, and just make it a whole lot easier, in my opinion. So we will say that if you had a previous eIDM account, this is the second bullet on screen, I think this is extremely important. Any clinician who had a previous eIDM account were automatically transitioned to HARP, and they'll use their existing eIDM user ID and password to sign into qpp.cms.gov to access their data, look through their data, and ultimately submit. For new clinicians, for all clinicians who did not previously have an eIDM account, you will need to enroll in HARP. So we do have a step-by-step guide that is available on the QPP website, and we'll talk about these resources in just a minute. But we also encourage you to reach out again to us at the Service Center or through our technical assistants, because they can all help you get that HARP account set up, your identity management account, to be successful in the submission period. One note that I do want to make, that I do want to call out here, is that the system will connect each user with their TIN, the taxpayer identification number, and then once you are connected, you'll be able to report data either at the individual level, at the group level, within your practice. Okay, charging forward, just to talk a little bit about the resources that I previously mentioned. So again, with our HARP system resources, we do have the Access User Guide that is available. And again, folks, all of this is available on qpp.cms.gov within our resource library. So you're able to find it once this call is over. So just navigate over to our website. We do have the QPP Access User Guide, some other additional helpful information such as what you'll need before you begin in creating an identity management account under the HARP system, registering for an account, connecting to an organization, managing access for security officials, so on and so forth. That information is within the user guide. We also have some really exciting and very helpful HARP demonstration videos. Anywhere from creating an account to connecting to an organization to approving role requests, those videos are also available as a first step to getting into our submission system. On the next slide, slide 9, just talk a little bit about some of the data submission resources. So I think this pairs nicely. So once you have your account and you're all set up and through that process, this will be the next step in kind of looking through some of what we have available as far as submission resources. Again, within our QPP resource library, we have the data submission FAQs, which we'll talk about a few of those in just a few minutes. We also have the data submission user guide. But what I really like, and this is something that we tried a little differently this year, is we have a number of demo videos that are available. Now last year I think we had 3 or 4 demo videos. They were a little lengthy, so we had some feedback from the clinician and stakeholder community to try to break those down a little bit more into bite-sized chunks. So as you can see, we have a number of different topics that we focus on. Again, a variety of information, and all of these videos are in the 3 to 5 minute range. So they're really quick hitter information. You can listen to them on the go, but they cover everything from just reviewing your data to submitting for specific performance categories, deleting data, working with third parties, so on and so forth. Great resources. Highly recommend you check them out even after our office hour session today, because I think there's a lot of really great information contained within those videos. Okay. Driving forward, again, on slide 10 and then 11, we mentioned at the start of our discussion today that in addition to all of the great education outreach materials that we have, we also have one-on-one assistance available to each of you. If you are in need of support, you can always start with Quality Payment Program Service Center. We do have that information at the bottom right-hand corner of the screen. QPP, if you'd like to email questions to them, it's qpp@cms.hhs.gov. We also have the phone number listed for the Service Center. But we also have our Technical Assistance Initiative and a number of networks that are currently working with clinicians to help them get their data into the system and be successful for 2018 and really kind of finalize the 2018 performance year at this point. So any one of these networks, whether it's the Small Underserved and Rural Support, which is customized support for small practices, our QuinnQIOs, Quality Innovation Networks and Quality Improvement Organizations, as well as our Practice Transformation Networks under the Transforming Clinical Practice Initiative, can help you through the submission process. So there's really no wrong door. You can reach out to any of these organizations. All of this information is also available under our Help and Support page on qpp.cms.gov. So if you are looking for direct contact information, that is available. I know we have the link on the slide itself, but you can also navigate over to the website and find the exact same information. All right. We're going to get into the Q&A portion of the session. Now, I know we have a couple of slides here with some frequently asked questions. I don't think I'm going to spend too much time here. A lot of these questions we also cover as a part of our FAQ guide. I'm going to try to address just a couple, maybe 1 or 2 from each of our slides, but then we're going to turn it over to you because we really want to hear from you. So maybe I'll spend 5 or so minutes here. Just as far as general access goes, do you need to sign into qpp.cms.gov? We have talked about that. So yes, in order to submit your data, you will want to sign into qpp.cms.gov to really get started. I mean, that's if you are submitting data on behalf of yourself or the clinicians in your practices. If you're working with a third party, such as an EHR vendor or maybe a registry who will be submitting data on your behalf, you do not necessarily need to sign into qpp.cms.gov. However, we highly, highly encourage you to sign in and just double check and make sure all of your data is in the system. That's an important piece of information. If that's the only takeaway from this slide, that's the biggest one. Just go in and double check. Make sure your information is there. I think a couple of these other pieces we'll talk about as we get into the Q&A. Let's move on to the next slide. Okay, great. So again, a couple of high-level questions that we've been hearing just in different channels and through different feedback mechanisms. I think the first two bullet points are some of the more common questions we have, so I'll just take a minute to go through these two questions, and then I think at that point we're going to turn it over to the open Q&A. So how do you determine which clinicians are displayed for our practice? It's a great question. So for clinicians who are displayed for the performance year 2018, those clinicians who are identified by their NPI, their National Provider Identifier, who were found as a part of your practice's claims during the eligibility determination periods for the 2018 performance year. This essentially means that these are the clinicians that we found claims in with dates of service between September 1st, 2017 and August 31st, 2018, and of course that allows for a 30-day runout. Those clinicians will appear in your list of clinicians. This may include clinicians who are no longer with your practice or who have terminated their assignments, so those folks will still be listed there. I will note that we are in the process of continually updating our eligibility data to remove clinicians who were only found in claims from your practice during the first determination period, which was September 1st, 2016 to August 31st, 2017. And until those clinicians are removed, they will continue to show underneath your practice. The other big question we get, the second bullet on screen here, is what happens if we have a MIPS eligible clinician who left our practice during the performance period? And we get this question quite a bit, so I'm hoping this helps to address some of the questions you may have. What does this mean for the 2018 performance period and the payment adjustments in 2020? So ultimately, this depends on how your practice chooses to participate in 2018. So if you are participating at the individual level, so you're submitting data on behalf of each MIPS eligible clinician, you are not required to submit individual data on behalf of a MIPS eligible clinician who left your practice during the 2018 performance period. However, we do encourage you to do so if you have the data available so that that clinician doesn't necessarily receive a final score of 0 and ultimately the negative 5% payment adjustment. So if you do submit data on behalf of that clinician, they'll receive a final score and the payment adjustment based on what was submitted. Again, if you don't submit, they'll get a 0 and a negative 5% adjustment. If your practice is participating at the group level, so again, that's aggregating all of the data on behalf of all of the MIPS eligible clinicians in the group, you will include that data for all MIPS eligible clinicians who were part of your practice during the performance period as appropriate to the measures and activities you've selected. And then all of the MIPS eligible clinicians in the group, including those who may have left your practice, will receive a final score and payment adjustment based on the group submission. So I hope that's helpful in answering those two questions. I think we have one more slide with questions, but I think we're going to skip slide 15 and get into the Q&A because we do want to hear from all of you with the time that we have remaining. So at this point, I'm going to turn it over to the operator to walk you through how to dial in, and then we'll reconvene in just a moment.
Thank you. We are now going to start the Q&A portion of the webinar. You can ask questions via chat or phone. To ask a question via phone, please dial 1-866-452-7887. Again, that's 1-866-452-7887. If prompted, provide conference ID 9772327. The ID number again, 9772327. Once you join the conference, you may ask a question by pressing star 1 on your telephone keypad. Again, that is star 1 to ask a question.
Okay. And while we wait for folks to dial in, just a couple of things. Again, we're going to do our best to try to answer as many questions as we can today. We'll try to answer your question as fully as we can. We do know that there are cases where we may have to follow up with you just based on the specifics of your question and having to do a little bit of additional research. So please just bear with us. Also, there may be times where it gets silent from us on the line. Don't worry, we haven't lost you. We haven't dropped the call. We're just chatting with each other in the room to make sure that we're giving you the best answer possible. Okay, with that, we'll take our first caller.
Again, if you would like to ask a question, please press star, then the number 1 on your telephone keypad. There are no questions in queue at this time.
Okay. Well, that's okay too. So we will remain on the line. We're actually going to also take a look at some of the questions that are coming into the chat. So if you have submitted something to us, we're trying to get through these, and if we'll start to flag some of these questions we might be able to answer right now. But if you do want to call in, please do so. That information is on screen, and we can kind of talk through your question at that point. So I'll certainly, if my colleagues see questions we want to answer, we're going to go through them right now and try to answer some additional questions.
We do have an audio question from Jessica Henderson.
Hi, Jessica.
Hello. Hi. So I just had a question. For 2008, our individual physicians were indicated that we didn't have to report due to low volume threshold. Is there anything that we need to do after that?
Nope. If you're exempt, there's nothing left for you to do.
Okay, very good. That's all I needed to know. Thank you so much.
Okay. Yep, thank you.
Again, you may press star 1 to ask a question.
So if folks continue to dial in, if you're interested. One question I did see that I do want to talk through, question around multiple files. I think it's a good question. It is something that we hear often. So just to talk through that, kind of frame it as, what happens if I upload multiple files? Great question. So ultimately what happens is we will keep and score the most recent file submitted by someone connected to your organization or by you for each performance category. For example, if you were to upload a file for quality measures and upload a file of improvement activities, we will keep both of those submissions because they're for 2 different performance categories. Now, if you were, let's just say in the same day, so what's today? Tuesday. So today's Tuesday. Let's say you submitted quality measures at 9 o'clock this morning, and then at 3 o'clock this afternoon after our office hour session you decided to resubmit some quality measures. We will only keep and score the measures that we received this afternoon for your quality performance category score because that was what was the most recent uploaded file for the performance categories. Again, highly recommend signing in, checking out your data, especially if you're working through a third-party vendor, just to make sure everything was loaded into the system the right way. Okay. Checking back in on the line, do we have any questions?
Again, to ask a question, please press star, then the number 1. There are no audio questions at this time.
Okay. So we're going to keep kind of navigating through the chat. I know as I see questions, I think my colleagues are answering them at the same time. So that's great. We're trying to work through these as quickly as possible. But again, if you do have a question, please feel free to dial in at this point. I know we did cover the multiple submission types, submission methods. I think we also covered a couple of these questions about what to do if you are exempt at this point. Again, if you are exempt from the program based on the information that you're seeing within the lookup tool for 2018, there's nothing further to do at this point. Keep looking through. And folks, for those who are submitting to the Q&As, we are trying to answer them as fast as possible, but feel free to also call in to us. Some good questions coming in just around this is really the first year submitting. Great questions just around getting a HARP and EIDM account set up. So again, I think one of the best approaches is to certainly start, because you will need to create a new identity management account, and certainly start with our resources on qpp.cms.gov. What we flagged for you earlier, really starting with that access user guide, that QPP access user guide, but also take a look at the HARP demonstration videos. They're very concise. They're going to walk you through everything you need to know. I think that's the best approach really to getting started. Of course, if you need help, please reach out, because we are here to help get you through the process as quickly as possible so that you can submit your data. Go ahead. Okay, good questions. Just keep them coming. And I'm certainly going to look to my colleagues too. If we see anything we want to address, just let us know. Just checking back in on the phone line. Do we have anyone waiting?
No questions at this time. Please press star 1 if you still have a question.
Okay, another question that just popped up really around voluntary submission. So if you submit voluntarily this year, do you have to submit 2019 if still deemed exempt? No. If you are exempt, you can voluntarily participate. So certainly for 2018, if you are exempt, you can voluntarily submit your data to us, and we will give you performance feedback. You will just not be tied to a payment adjustment. 2018 is a little bit different because 2019 is a little bit different. As you see, I've got to make sure I stay on track with my own performance years. 2019 is a little bit different because we do now offer what we're calling the opt-in capability. So if you are exempt due to the low volume threshold, but if you were still to meet at least one of the criterion under the threshold, you could still opt into the program. We do have some additional guidance that will be coming on that a little later on in a couple of weeks. Hopefully we'll have that out there. But there is some great information under the 2019 section of the resource library for folks to check out if that's something, kind of thinking ahead to 2019, if that's something that you are interested in.
Yeah, I'm seeing a question from Sue here in the chat box. Just about submitting, so you're using CMS web interface to submit data for 2018. Quality deadline, March 22nd. The PI, it's the same. So everything you're submitting through web interface has the same deadline, so March 22nd.
Yeah, that's a good question. I think there's a follow-up question to that too, not so much for the CMS web interface, but just the dates in general. So again, just as a refresher, key dates, the submission window is open right now, so I won't focus on when we started, but all data needs to be into us by April 2nd, 2019 by 8 o'clock Eastern. Again, as Katie mentioned, for the web interface, it's a little different. March 22nd, 2019 is the cutoff, but the absolute last day is April 2nd, 2019. And checking back in on the line, do we have any callers?
No questions at this time.
Okay, thank you. And folks, we're still looking through your questions. I know subject matter experts are addressing a lot of these questions individually for you all, which is great. So we'll continue working through. If we see anything, we'll be sure to flag it here. And as always, feel free to call in. Happy to chat with you all today. And even if it's not a question, just any feedback that you might have for us on the submission feature itself, any of our resources, the QPP website, we're always happy to hear that as well. Okay. And we're going to keep navigating through a couple of good questions as it relates to checking your eligibility for the performance years. So yes, the question was, can you still check your eligibility online for 2018? The answer is yes. If you navigate to qpp.cms.gov and you navigate over to what's called the QPP Participation Status Lookup Tool, you can punch in an NPI address right on the screen, and you can actually check across all of our performance years at this point, which is a really great feature just to see where you're at from 2017 to 2018 to 2019. All of that information is available, so you just have to keep tabbing, just depending on what performance year you're looking for. I think this question might have been for 2018, so that 2018 information is still available. And then, of course, 2019, we just released that eligibility, I think, 2 or 3 weeks ago, so that is also available in the lookup tool as well. These are great questions.
We have an audio question from Kelly Dennis.
Great. Hi, Kelly.
Hello. I was just typing it too, so thank you for taking the question. I wanted to know, is there a helpline for MIPS similar to the PQRS helpline? I found something online, but both numbers I dialed went nowhere.
Oh, that's not good. But yes, there is. So it's a little difficult to see, so I apologize for that, and we won't go back. But if you do have a question specific to MIPS, highly encourage you to either email us. This is our Quality Payment Program Service Center at qpp@cms.hhs.gov. Or if you do want to call in, we do have a line at 1-866-288-8292.
Excellent. Thank you so much.
Sure, absolutely.
And if I could ask another question, I'd like to double check, and I do think I found the answer in a book for MIPS, but I just wanted to confirm that if you are a small group based of 15 or less, that is the only way you can still report by claims submission?
That's for 2019.
Correct. For 2019, if you're 16 or more, you have to choose one of the other ways of reporting. I'm just confirming.
Yep, that's correct. Claims is only available to small practices in 2019.
Okay, thank you. I interpreted it that a different way, and so I appreciate the confirmation. Thank you.
Sure, thank you.
Again, to ask a question, star then the number 1. No additional questions at this time.
Okay. Still working through a lot of the questions in here. These are really great questions, and appreciate you all taking the time to join us today, and certainly send us your questions. Okay, so just in looking through some of the questions, we are getting some questions just around our accountable care organizations and submission for 2018. So we're very fortunate to have our subject matter expert, Rabia Khan, here with us, who's just going to talk a little bit about submission for ACOs.
Sure. So just going to speak about the Medicare Shared Savings Program, ACOs, and the interactions with the Quality Payment Program. So for eligible clinicians who are identified as the snapshots as being participating in a shared savings program, ACO, they will be scored under MIPS using the APM scoring standard. So the quality performance category will be scored using the data reported by the ACO, and it will be the web interface, the CMS web interface data, and the CAHPS for ACO survey data that will be included in calculating that quality performance category. Now, when it comes to improvement activities, it was determined earlier in the performance year that as an APM, Shared Savings Program ACOs, eligible clinicians in those ACOs will get full credit for IA. So no additional reporting for IA is needed. Cost is a category that will not be assessed under the APM scoring standard, so the remaining category is promoting interoperability. And for
providers in a shared savings program ACO, TINs must report at the group level or solo practice level for the promoting interoperability category. In terms of how it gets scored, it ultimately, all of the ACO participant TIN reported data gets aggregated and weighted, so there's a single ACO level score that gets applied to all of the eligible clinicians in the ACO. We do have an interactions guide that is available in the Quality Payment Program resource library that further details the interactions with the Quality Payment Programs, reviews the MIPS APM scoring standard for eligible clinicians in the Shared Savings Program ACO under scenarios where the ACO successfully reports, and in the event the ACO does not completely report the quality data, and it also provides some information for ACOs that are participating in the advanced APM tracks, and eligible clinicians can qualify for qualifying APM participant status. So I highly encourage folks to review the interactions guide that is available.
And if we have any additional questions or follow-up questions for Rabia, we'll be here. So please just feel free to dial in. We'll keep going through the Q&A to see if there's any follow-ups at that point. One question I did see that I did want to flag, which is a really great question. And I think this may be coming from someone who's in the program both years, 2017 and 2018, which is a great question. And just in terms of what am I going to see as part of submission now versus what will I see either during this, later on in the submission period or maybe even post-submission, it's a great question. So let me just run through the list of what you'll see, what you would have seen right at the top, what you'll see coming, and then what will be post-submission. So when we opened on January 2nd, what you'll see in the system will be, and this is really focused more on kind of the special scoring circumstances. So, things like if you're a small practice, the special double weighting for improvement activities. So that's an example of some of the special weighting. So on January 2nd, what you would have seen is clinicians and groups that qualify for a 0% weighting of the promoting interoperability performance category, based on either the clinician type or the special status, and we can talk a little bit more about that if we need to. Clinicians and groups that qualify for additional points under improvement activities based on special status. So this is the example I just gave you with small practices get double weighting, so they would see that right off the bat. Clinicians who qualify for the 50% credit in the improvement activities performance category, or the scoring under the alternative payment model scoring standard based on participation in a MIPS APM from either the first or second snapshot dates. And Robbie just talked a little bit about that earlier. You'll also see right off the bat clinicians who were excluded from MIPS because they have what we call qualifying APM participant status or QP status, again based on the first or second APM snapshot dates. Now, some of the information that's coming that'll be added at some point during the submission period. Seeing the reweighting for promoting interoperability based on the hardship exception applications, clinicians and groups that qualify for a 0% weighting of any of the performance categories based on our extreme and uncontrollable circumstances exception requests, that would also be added. That also kind of takes into account those who qualify for the automatic extreme and uncontrollable circumstances policy, so both of those pieces will be added. And this also kind of ties back to the last 2 points I mentioned, clinicians who qualify for the 50% credit for improvement activities under the APM scoring standard based on the third snapshot date, as well as clinicians and groups who are excluded from MIPS because they have that QP status based on the third snapshot date. So that information is also forthcoming. Now, things that you can anticipate seeing after the submission period has closed include clinicians and groups who will receive full credit, full improvement activities performance category credit based on their participation in our CMS study on burdens associated with reporting quality measures. Not sure if anyone on the call participated in that last year, but that is an option that is available. Also, what you'll see are clinicians in the Shared Savings Program ACO who qualify for scoring under the APM scoring standard based on the 4th snapshot date, which was added for the 2018 performance period, and we can answer those questions if you have anything around those as well. And finally, clinicians who qualify for the 50% credit improvement activities based on participation in an APM following the 3rd APM snapshot date. So some of that information is also coming. Fortunately, everything that I just gave you, we've also listed out in our FAQs guide. So if you didn't catch every piece of that, it is available on the resource library under the FAQ section. We do have that listed. And as we do make those adjustments, we are adjusting our education outreach materials as well. So we keep those updated as best we can. Okay. Anyone dial in while I was talking through some of those points?
We have an audio question from Alexis Shaner.
Great.
Hi, good morning. Thank you for your webinar. I have a question related to one of our groups who are mostly pediatric physicians.
Okay.
The question that I have is for our, on the QPP website itself, what I'm finding is that we are eligible as a group, but for some of the individual physicians that are pediatric, they're not showing up as associated with our tax ID. So I just wanted to get clarification. Is this mostly due to the fact that those physicians don't bill Medicare Part B, and that's how they're associated with our TIN?
Yes, that is absolutely correct. So right now what you should see are clinicians who have billed Medicare Part B claims under your TIN between September 1st, 2017 and August 31st, 2018. So if they bill any Part B claims, you would not see them. Or if they joined your practice in the last 4 months of the year, you also wouldn't see them up here list as well.
Okay, that's very helpful. Thank you.
Sure. Thank you.
Again, to ask a question, star then the number 1. There are no additional questions at this time.
Okay. The good news is, folks, we still have plenty of time left in our session, so we'll stay right here. And again, I do want to thank all of our subject matter experts who are working through the questions in the chat right now. There's some really great questions coming in, so this is helpful for us to see as well. There were a couple specific questions just around specifically the promoting interoperability performance category and just, certain aspects of whether we can help out with things like, making sure you're able to submit your security risk analysis measure. So for folks who do find themselves in the position of, needing to report PI, again, I highly encourage you to reach out to our technical assistants. Depending on what state you're in, there is a specific organization working very closely and providing MIPS support within each of these performance categories. So again, you can find that information on our help and support page on qpp.cms.gov. We actually even have a couple of interactive maps on the site, so if you just select your state, you'll be able to find the organization that can work one-on-one with you. In fact, in most cases, they will, if you reach out to them, they'll either answer on the spot or they'll be connecting with you within 1 business day. So it is a very quick turnaround. So if there are elements of not just promoting interoperability, but any of the other performance categories that you're still a little stuck on for 2018, I highly encourage you to reach out to these organizations. They can call you, email you, even schedule a one-on-one visit so they can come out and really help you through. So definitely take that avenue. Go ahead, Maura.
We have an audio question from Kelly Dennis.
Hi,
Kelly.
Ed? Can you hear me?
Yep. How are you?
Fine. Thank you for taking another question from me. And first, I'd like to thank you for, the attempts that you guys do for education. I really appreciate it. One of the things that I've seen varied information on is how long you should keep your data to support information. And if you don't mind, I'll include PQRS because I would like to know how long that data has to be kept. I've seen 7 to 10 years. So is there a consensus amongst you?
Yeah, that's a great question. So it is 6 years. That's our guidance to keep it maintained for 6 years. And we do also offer, I'm not sure you may have already seen this, but we do offer the data validation information on the resource library. I know, Katie, you have a little more information on that.
Yeah, sure. So we have on our on qpp.cms.gov in our resource library, we have a zip file that has all of our 2018 MIPS data validation criteria information. So that really lays out specifically for each performance category what you need to do as far as auditing and record retention purposes. It gives a little bit more information.
Thank you. So that would be 6 years for PQRS and 6 years for MIPS?
6 years for MIPS.
Okay.
PQRS, we're all looking.
We're all a little fuzzy on that one.
What the length is right now.
Thank you so much. And again, like I said, I really do appreciate the education that you guys offer. And I know that you're going to have the slides available, but will the Q&A on the left side be available as well?
We normally don't post the Q&As just because we get so many of them. But we can certainly, if that's helpful to know that you find this very informational and that you appreciate these Q&As. So maybe we can take a look through and just see what our top Q&As are from this session, and either address them on a future session or have them available as part of a slide deck that we post.
I appreciate it. I had some difficulty logging in because of my own system, Flash Adobe, but by reading through the left, I could tell if the questions had been asked already.
Sure. No worries. We appreciate you calling in.
Thank you.
Thank you.
We did have a couple of questions coming into the chat about taking screenshots and the need to do that. There is no need, you do not need to do that. Once you enter your data, it is saved by our system. There is, however, you can use your browser's native print functionality. So on the upper right-hand corner of each page, you can print a record of your data if that makes you feel more secure. Absolutely. Certainly don't want to stop people from taking measures that make them feel confident. A couple of other questions that have come in. One is we're submitting data by a registry. Can we also submit data by claims? So for 2018, we are past the point of being able to report your quality measures by claims. If you're a small practice, either reporting individually or as a group for 2019, you can certainly report quality measures both through the claims collection type and through the MIPS CQM collection type, which are formally the registry measures. And another couple, also seeing some questions around payment adjustments. So if we report as a group and an individual an individual clinician in our practice reports individually, will providers who have a higher individual score get the higher of the two scores? That answer is yes. If you report as an individual and your practice reports as a group, you will receive the payment adjustment associated with the higher of those two scores.
Thank you, Maura. That's actually the question I was going to address. Mind melting. So, folks, we do have a couple of minutes left. If you do want to call in, I just want to check in again. Is there anyone on the line?
No questions at this time.
Okay, great. So we do have a couple minutes left. We will kind of end right at the top of the hour. So this is, I guess we'll call this our last call for questions at this point, at least through the phone. Again, we appreciate all the questions that are coming in. Trying to get through these questions as fast as possible. So just again to reiterate, a lot of questions on when the slides will be posted. I'd say it's about 2 weeks. So we'll have the slides, the transcript from this call, which is also helpful because the Q&As that we've been talking about on the phone line and just verbally communicating will be part of that transcript, as well as the slide deck will be available in the webinar resource library on qpp.cms.gov. We'll send out just an FYI that those resources are available, similar to all the other resources that we create and post for each performance year. So just be on the lookout for that. Again, highly recommend signing up for the listserv, qpp.cms.gov, and just entering your email at the very bottom of the screen. That'll keep you up to date for everything that you need to know.
One other question. I've seen a couple questions around using the web interface for quality, and if you use it to submit your PI, you're promoting interoperability and improvement activities as well. You use the attestation if you're not working with a vendor to upload a file. So once you have entered your quality data in the web interface, you could redirect to the main submission page on qpp.cms.gov, and you can attest to your promoting interoperability measures and improvement activities.
Perfect. Good. Okay. Continuing to look through the questions. I will say, again, I know we have a lot of our folks working through questions, so I'm trying to call out what I don't see being answered, but everything seems to be moving along. If we didn't get a chance to get to your question, again, I know we're starting to see a lot more questions come in at this point. So if we didn't get a chance to get to your question today, don't worry. Again, you can always reach out to us at the service center. We can address the question there through our technical assistants. But I will also mention that we are planning to hold another office hour session in the March timeframe. So we'll have additional details available to you all very soon, again, through the listserv. So if you are interested, please just keep an eye out for that future office hour session. It'll be the 19th. Thank you, Katie. March 19th. I believe it's also from 2 to 3, so it's another Tuesday in March, something a little closer to the end of the submission period so that we can help triage any remaining questions that you have. So highly encourage you to sign up for that when we have the registration out.
And the registration is up on the, if you go to qpp.cms.gov and go to our webinar library, at the top it has our upcoming webinar. So the registration information link is right there for you too.
So there's still plenty of time. Certainly we want you to, navigate into the system, submit your data, make sure everything's looking good on your end. But again, if you do have questions, feel free to come back to us through our different resource channels, and we'll do our best to make sure we're helping you out along the way.
We did have another audio question that came in.
Perfect. I was just going to check in with you.
Kamiko Jefferson.
Hi. I was actually questioning the 60% of data that needs to be submitted for the quality measure. I did type it in just in case one of the folks gets it. How do you determine what 60% of the data you're submitting? If you go a full year, I just, and I take the whole gamut of the year, how do we determine what 60%?
This is for go ahead. Sorry.
Yeah. So you're referring to the data completeness requirements for the quality measure. So this is where you would need to report performance on 60% of the patients of your eligible population for the given measure. Is there a specific, this is for methods other than the CMS web interface. Is there a specific way that you're reporting your data?
I'm reporting it, through a QCDR.
Okay. So that would likely be all payer data, but as long your QCDR should be collecting information about the number of eligible instances that you have that qualify for the measure.
Right.
And you would need to report performance on at least 60% of them to meet the data completeness criteria.
Okay. Thank you.
Okay. Thank you. Okay, well, we are at the top of the hour. I do want to thank each of you for calling in, sending us your questions. I think we've got a lot of very helpful questions and also some really great feedback that we're going to look through after our session concludes today. But again, thank you all. Remember, we do have a second session coming, so please go onto the webinar library right now and sign up for that session if you're interested in potentially asking some additional questions as we get closer to the end of submission. Please be mindful that the submission period does end on April 2nd. So just keep that in mind as we get closer. Still plenty of time to get your data into us, but just keep that date in mind. And with that, we are going to adjourn for today. Thank you all so much, and we'll talk to you again soon.
Thank you. This concludes today's conference. You may now disconnect. Speakers, please hold the line.